Welcome to Medical Confessions. Today we're going to be talking about depression.
Yes.
And how we treat it, because there's like a cool new thing with ketamine.
Yeah,
and
can I take credit for that one? Because I found the article
please.
and I was super excited about it because it was talking about the, the way that ketamine works normally, as we know in our profession. I saw the article, and I don't normally get interested in medical type stuff like you do. And then I actually started reading the article, and it was really cool that they're now saying that it's got some pretty overwhelmingly good results working for people with depression.
Well, yeah, and in our profession, how we use ketamine, we use it at these higher doses, and so you just never think about it used in smaller doses and how it can actually affect something like depression, but it makes sense. And so then I did look up the 2 studies that they did on it, and it is pretty fascinating, especially in that short-term range, because that ketamine's kicking in within 30 minutes versus your standard antidepressant meds that can take weeks before they start working. And so It's great for those truly suicidal people, and they're fix them in 30 minutes. It's fantastic.
Well, where do we start? Do we start with what depression is, or do we start with,
Where would you like to start?
Well, let's talk about depression.
Yeah, it is. World Health Organization claims that it is the #1 disability in the world.
Mm-hmm.
So that's.
And do you think this is something that's new, or do you think it's always just kind of been? I've never felt like I've been depressed. Any more than the normal. Darn, I didn't get the job, or But I've never felt like I've dealt with long-term depression. And so you hear about people that seem to be debilitated by it, and I've always just been like, go for a run. I don't understand it because I've never been afflicted with it, but it seems like anymore everybody has it, everyone's getting treated for it. I mean, I know half a dozen people quickly off the top of my head that take medications for it, and I'm like, is it really
did you
that
get
prevalent,
any
or
postpartum depression or anything like that? You're fine?
Nothing.
You?
No, I was good.
I
was just happy to not be fat anymore. And I was even kind of sick after both of them, and I was just I felt great.
Huh.
But my parents neither have. My mom's always pretty hormonally even keel, and I don't know. Is it genetic?
And it is, percentage-wise, if your family members are prone to depression, you're going to be prone to depression, and and there's several different kinds, and at the end of the day, it's based on 3 basic molecules in your body: serotonin, norepinephrine, and dopamine. And some people have abnormalities of those, abnormal amounts, different ways that they get produced, and it's just abnormal, so they're going to have these signs of depression. But yeah, I've never been really what I would claim depressed either. I mean, there's been days where it's just you feel like Eeyore, and you're like, oh, the world's falling down around me,
Right.
But it's never long term, like you said, go for a run or go outside or, whatever it is that you do to.
And I can't even imagine you depressed.
I've been depressed once, and
for a long period of time?
Yeah. It was, and it's never happened before or since.
Yeah.
So it was just this one isolated incident, and it lasted probably a month or 2 before I got help. And
your description though makes sense to me when you say an isolated incident. It makes sense to me that the death of a family member, the breakup of a relationship, that a sick child, those things make sense, and I'm like, okay, I could see why somebody's in a funk and having a hard time coping. But
this was different.
Was it?
Yeah, there's been times where I'm like, I struggle with something and I'm sad about something, but this was, it had hit me so hard. I'd get out of bed, try and get Parker to school, and on the way to taking him to school, I would just be bawling the whole way. And I couldn't control it. That's what's weird. I would drop him off at school, go home, and sleep all day. Pick him up, same thing. Just cry on the way home. I felt like it was absolutely foreign to me.
So what remedied it? What fixed it for you?
I sought out a counselor to try and deal with everything that was going on at the time, and I didn't have to take any medication for it, thankfully, but I just dealt with it.
Well, what about the people though that I know of a person in my life that just felt overwhelmed with day-to-day life, and we're talking no children, no big events, no nothing, and I look at that individual and go, you're not managing your time well, you're not managing your money well, you're not taking enough time to rest, like all these really obvious, you're not exercising,
but when you're in that depression, like you can't.
But
like,
which came first?
It.
Well, and I don't think that this person was in the depression as you're explaining. And I don't know which came first.
Oh, gotcha.
Was the poor management of just life in general, and then it became, and so what was the magic fix? Get put on medication, but still continuing all the same behaviors, but not caring because now they're on medication.
Interesting.
Right?
Well, I don't know if it's a not caring. I mean,
no, that's actually...
Is that what he said? Or her? I don't even know.
Yeah, it wasn't a male, but... Well, no, it just makes everything okay because I don't feel the same way. And I'm like, I don't feel like that's a good fix. Like, I'm not saying this is for everybody. I just know this individual, to not care that your bank account's low is not a good long-term solution.
Yeah. Well, and I think because it is so different for everybody, it's really tough to nail down that one other than to say that it is so exceedingly common.
Right.
That it's everybody has that range and that bell curve, and I've gone through like a day of just being like Eeyore, and feeling bad for myself, and then I'm over it. But then those other people who are just chronically for months just depressed, and especially, bipolar, it's not necessarily a true depression, but when they're in their low phases, that is a true depression that they just can't kick. And, so I think because it is so different for everybody, it's so tough to nail down, which is why if you are feeling that way, you should probably go talk to your doc so they can specifically nail down for you, because there's several. I mean, medication is kind of like the last resort. They don't like to put people on these medications because they have some long-term consequences, especially, you start talking about messing with neurotransmitters that affect mood. Once you're on that, it's going to affect a lot of other things, and you're going to never be able to get off of it.
Right. Well, and I know another person who's been on them for years and now trying to wean off of them and having a hell of a time, know, and this person is like, I wish I would have known this as a younger person, that how hard it was going to be and how much it, so that's why I know this other person who's just beginning on that path, and I know this other person that's at the end of that path. And again, I've never dealt with it myself, but I'm just thinking, was the medication that necessary, or was counseling and a change? We laugh, but maybe a life coach. I mean, maybe literally somebody outside of their original circle and family to say, hey,
well, and it's true.
Do you need to stop at Starbucks every single day and spend what limited income you have? I feel like a lot of the stress might have been remedied with some good guidance.
Well, and everybody's confirmation bias is so strong that you just don't even see the actions that you're doing.
Right.
Or see that you are depressed. A lot of times people just don't know, I'm just gonna, I think we all know a few people that are just like constantly, you should probably, but they just don't know they're in that case.
And I just think of those extreme cases like April, that I know that there's people that have those events and just literally can't help it. But I'm wondering, is it as prominent as we think, or is it just one of these things where it's kind of a natural thing? People are going to go through highs and lows in your life, and it's about coping and remedying them.
Well, this is why ketamine is so exciting for a treatment, because these other drugs, they take weeks to start working. Then once you're on them, you've got to stay on them, and then the dosage range is so hard to nail down for every specific person. And then, once you decide, okay, let's see if we can get off these now, it takes forever. But ketamine is like it's going to happen within 30 minutes.
Let's talk about ketamine. What is ketamine?
Well, I think before we get to that, maybe just talk about the specifics of how depression is working and how they try to manage it, so that you can see why ketamine is so different and so exciting, I think. But anyways, depression. So the three main molecules that everybody tries to affect with depression are serotonin, norepinephrine, dopamine. These are your feel-good neurotransmitters. Is going to be your dopamine and your serotonin. Norepinephrine also helps with some of that. And so there are 5 classes of drugs that they use when we're talking about drugs. Like we said, most docs try to stay away from that if you can, and counseling or life coaching or whatever it is to try and help with. Sleep is a huge one. Good sleep patterns is going to be a huge thing, like a number one treatment in my mind.
Right.
So they just try different classes of drugs to try and fix that. It started in the 50s. They came up with, so all 3 of these things are called monoamines. And so they came up, there's a molecule in your body called monoamine oxidase, and that breaks down monoamines. So it's breaking down your serotonin and your norepinephrine. And so what they did is they came up with this drugs that would inhibit that. and so that you would have more serotonin and norepinephrine and dopamine in your body for you to feel good.
Right.
And that was in the 50s. The problem with those is they come with a lot of bad side effects, and they react with a lot of things, including foods. So when you're on those, you're going to be talking about diet and making sure you're eating the right things, because they come with some problems. So then there's another class, tricyclic antidepressants. They work a little bit different than a lot of them, in that they inhibit the reabsorption of serotonin into your neurons and norepinephrine. And so then, again, leaving it available for your body to use. And again, that was the 50s, but again, those come with huge problems and side effects. But they are kind of making a resurgence. I've noticed lately a lot of patients we see are starting to be put on those versus some other ones, which
like
I'm not.
Trade names would be.
Yeah, so trade names like amitriptyline, nortriptyline for tricyclics. The MAOIs are going to be like parnate and phenylzine. That's a fun word to say. Anyways, but those ones, they use MAOIs for quite a few other things other than just depression. But then in the 70s, they specifically said, okay, these ones are having a lot of side effects. This is a pretty, robust problem. So they actually specifically started coming up with some drugs. So the first one was, they call them SSRIs, so selective serotonin reuptake inhibitors. And so what they do is, when your neurons are transmitting an impulse from one neuron to the next, you have a synapse, and these molecules actually will go from one neuron to the next. And these SSRIs, what they'll do is they'll selectively not allow serotonin to actually move on to the next neuron, so that reuptake inhibitor, and it leaves more in that synapse for your brain to feel good. And then so that came around in the 70s, and then in the 90s they came up with kind of the same thing, only also affecting norepinephrine. So they're SNRIs, so serotonin norepinephrine reuptake inhibitors. And so those would be like Effexor and Cymbalta. Your SSRIs are going to be like Zoloft, Paxil, Prozac, things like that. But again, all of these drugs, they take some time to work. A couple weeks sometimes. Some people a lot quicker. But then also the dosage range is different for everybody, and so they docs will generally start off with a low dose and work your way up, and then you can't just go off of them because your body's used to producing these molecules naturally, and so you're going to be affecting that, so maybe your body doesn't produce as much anymore. But if you quit cold turkey, now you're going to get huge swings in these molecules, and you're going to have moods, who knows, super depressed maybe super high. Just kind of depends on how your body reacts, but you can't just stop. You have to be weaned off them slowly. So they have all these problems. And so then, ketamine comes into the picture. About 20 years ago, they knew it was already working. They just didn't know why. And then there's some new studies that just came out, too, specifically, that kind of identified what exactly it's doing. And so it's not really affecting any of those three molecules like the other ones are. And what it's doing, there's an area of your brain called your lateral habenula. And that area they found is when you are expecting a reward, so like a mouse inside of a maze and they get some sort of food at the end, if you're expecting this reward and you don't get it, this area starts lighting up in your brain. So they kind of call it the disappointment circuit, like, disappointed. And so ketamine affects that area of your brain and kind of inhibits that area from firing off using a different glutamate is the molecule that's kind of affecting to do that. It also helps with MDMA receptors, so like ecstasy is a MDMA receptor stimulant, agonist. So I've been talking a lot. Should I stop?
No, I mean, you're explaining it.
Yeah.
So
either way,
and I can't pronounce most of those words.
And so what the studies have done is they found, looking at this particular LHB section of your brain, what they've seen in rats that are prone to depression is they get these bursts of activity in this area, and they've noticed that people who are depressed also have these bursts. And so they can actually they use optogenics, so they're basically using light impulses to stimulate nerves, and they can actually stimulate that area on purpose with light, and they see that when they do, things become depressed. And so it's these bursts of activity in this particular area of your brain. So ketamine will block that.
Right.
And so because it acts so quickly, like within that 30-minute range, and it does last for, some of the studies, there's only been 2 really ones on this specifically, and they were, the effects last for like a week or so. And so it's super promising in that all of these people, who maybe they're not long-term depressed, they're just going through a couple of weeks or a month of problems, well, shoot, give them some ketamine and then they'll be fine, maybe, but the big one is, what do you do with these people who are truly suicidal right now?
Right.
There's not really a ton of medications you can give that aren't just like Haldol and things like that just, they're basically depressants, and so they're just lethargic and whatever, but so those are tough ones. So these suicidal patients, well, shoot, if you can truly give them this ketamine and it lasts in 30 minutes, well, fantastic,
right.
And it's going to solve a lot of problems. So
doesn't it help also with kind of rerouting? Like, something in the article led me to believe that it actually helps create kind of a rerouting around those areas, so the depressant areas that light up.
Well, yeah, so it's rerouting because it's blocking the nerve impulse to that area, so then you can say it's rerouting the impulse somewhere else.
Yeah,
I took
something
that.
in the article led me to believe that it might actually help, once off the medication, help the person long term. I'll have to reread it. There was something on there that made me feel like it was especially for somebody that maybe has a long-term issue, so maybe just kind of the Debbie Downer that has more of those areas, it actually helps prevent, so later.
Well, I can see that. I mean, and this is going to be total anecdotal, but like if you start stimulating a certain area of your brain, the myelin sheaths around your nerves actually engorge a little bit, and you get faster impulses.
Right.
I mean, this is if you're going to be if you want to be a concert pianist, you got to start at 5 because those areas of your brain are getting myelinated at that point. And so similar here, if you're using those specific areas, so like inhibiting the nerve impulse from going there, I could see how you would then engorge that white matter, and later on then it's easier to reroute that. And I don't know if that's I don't remember that specifically.
Yeah, and I couldn't explain it in the way that you just did, but there was something that led me to believe that it might be a promising long term, that helping these people kind of, rewire their brain, I guess, for lack of better terms.
Well, and I could see that being what they mean by that.
Yeah.
I took, I kind of skimmed that article and then went to the studies, but I took it
as... Of course
as...
you did.
Well... You can read someone else's interpretation, or you can actually read what happened.
I just liked it because it seemed very different than other medications. Therefore, this isn't a long-term fix, but this will help get you through that period, and then maybe it's a fix. So it's not going to have the same other medications that you come off of. You have to be weaned off of, and now you have to kind of relearn. Your body has to figure out how to deal with it, or you have to figure out through counseling. This looked like it might be actually. Medicinal, it's going to fix the issue long term,
which is fantastic, honestly.
Right. And the wonder drug. That's what it seemed like. Yeah.
Well, and it, honestly, like you say, it is kind of feeling like the wonder drug, because just in the last few years, I mean, rewind 10 years ago, and maybe they were using it for conscious sedation for kids.
Right.
And now, we're intubate people, we're using it. Pain management, we're using it. Excited delirium patients, I mean, that's your go-to. And it's all just dose dependent. The only issue, obviously, because this is all very new, right? So, I mean, you can't just go out to your doc and say, hey, give me some ketamine, I'm depressed.
Right.
Not going to happen. But it is so promising. Now you've got to start worrying about the addiction stuff,
right?
Because it is like an opioid. I mean, it's not an opioid, but it's affecting an MDMA receptor, which is going to, become prone to some addiction issues. So, because it is so new, how are we going to make this work long term? Because we also don't want to be, you're depressed. Let's get you addicted to heroin. That's a good idea.
Right.
I mean, not working out. Anyway, so it'll be exciting to see where it goes. I was super pumped when you brought it up because I hadn't heard of that.
Right.
And then you look it up and you're like, oh my God, that looks fantastic. Let's throw away all these other ones with all these problems. This seems like it's going to fix you right now. Now, is that going to work long term? Maybe, because you're rerouting this. But again, at the same time, no one's really nailed down specifically what is a cause of depression. Because it is so different for everybody. Is it a serotonin problem? Is it this LHB section of your brain with these bursts? Is that the problem? Maybe one person it's this, another person it's this.
Right.
So you've really got to get specific and just go talk to your doc and say, hey, feeling kind of depressed.
Right.
What do we want to do about this?
Well, and it's kind of interesting to me because this article came out at a time when like I said, I'm, I have a relationship with a person who's just starting down this path, and then someone else who started down this path way before I knew them. And the one that's trying to get off the medication is a self-described Debbie Downer. And she said, high school and college, I was always that friend. And she said, and it was a lot of times it was people's perceptions of her, that she just wasn't loud, wasn't outgoing, and she wasn't necessarily unhappy, but it looked that way because she was not very excitable or, what have you. But so then, as she said, it was almost like a self-fulfilling prophecy, like, people are just like, oh, it's a Debbie Downer. So then she just kind of believed it, and which came first. But she said she just went on these medications, has been on them her entire adult life, even switching different practitioners, and they've just been like, oh, you're on that, just carry on. And so now, this person in her 50s is like, I have to get off this medication, and it's been really horrible. And very, very similar personality to the person I know that's just started down the path. And I'm like, is there really something wrong, or are you just not a very emotional person, or are you a pretty, and so it's kind of funny. I'm not saying that depression's not real. I just wonder, does it always need to be treated, or is that just the individual, or is there things in their life that, because like she said, if somebody would have sat me down and told me how to balance my checkbook, how to, how to have sleepy health, good sleep habits, and not go to the college party till 2 a.m. and actually go to bed and get in bed at 9. Was I really depressed because I was overworked at school, or was it because I was drinking and partying all night? And so it's just kind of interesting to me. This article popped up, and I'm like, huh.
Well, and it's funny you bring that up, that like, is it self-fulfilling prophecy sort of thing? Because it's in psychology, it's a known thing. I mean, confirmation bias is a thing.
Right.
But then it's also known, in the education environment, they call it the Pygmalion effect. In the work environment, they call it the Gollum effect. But at the end of the day, it's all the same thing, and that is expectation placed on somebody will actually result in that thing happening.
Right.
And it's just because of how confirmation bias works in your brain, and it's great for natural selection in the wild. Kind of sucks if you're focused on negative things,
right?
Because eventually it will just become negative for you. So you do have to, at some point, get out of that mindset. But other people, it's not that. It's a true serotonin problem. So it's so complex. At the end of the day, if it's a singular person, you just got to go and talk to your doc, and he's got to do a good, maybe it's a counselor that does a good,
Well, and I was going to say, that's my thing, is that you bring in a doc, and their workday is overloaded, and they get these 10 or 15 minutes, and they're coming in, and they're sitting down with somebody that maybe doesn't even have a really good grasp of what's going on anyway. And so, what's wrong? Oh, I'm just depressed. And so I just wonder, how much time does a doc have to really address it? How much honest, good analytical look at somebody's, so it's just kind of funny to me that it seems like there would have to be a better, process, a mental health professional. Well, it seems like that should almost be the go-to.
Well, and I agree, because it truly is, coaching on how to deal with things, because it is, it's fun, and not fun, but it's interesting to sit back and watch that self-fulfilling prophecy maintain, because, there are work environments, where you get these administrators who say things like, oh my goodness, my workers are just like one step above, fast food workers, and then magically over time you're just watching this environment kind of turn into that, because that's how the administration is treating people. It's interesting, and then all of a sudden all these bad things start happening, and you're like, oh, why is it happening? And you're like, well, the Gollum effect's been around forever, so this makes sense. Maybe we should just change mindsets, and then everything fixes. And that's the same way with depression. If you're in that mindset, it's so easy to stay in it. It's hard to break away, and you need a counselor to maybe change how you're thinking. And it's truly a how you think issue. But then for other people, it's an actual hormone problem or a neurotransmitter problem. So it's a tough cookie to crack, that one.
Yeah.
It feels like it was bad.
Yeah, it was.
Yeah.
But at the same time, I recognize that this is not normal for me, and just sought help. And I do that often. Like, if there's something wrong, I can recognize it within myself, which I'm thankful for, because a lot of people don't do that, or stay in that. I cannot, looking back at it now, because I didn't realize in it how bad it was until I was out of it, and I could look back and was like,
holy cow.
I was in deep.
Right.
Like, geez.
And the stigma with it, like I think it's one thing to say lots of people are depressed, but I think to actually say no, like you're allowed to feel really bad about something, or to have to have those events and you don't have to hide it, or to be able to communicate that to family or friends. Like I think that's my thing, is I haven't been to that stage. I've had some pretty bad runs where things sucked, but I think if I got to that point, it would be nice to be able to tell the spouse, the best friend, the whatever, like, hey, I'm not doing well. This is bad.
Well, and I think in it, the only person that really saw me was Parker.
Yeah.
Because when you're in that state, you don't want to see anybody.
Yeah.
You don't even want to talk to your best friend. I probably didn't talk to my parents or get on the phone with friends because I was just like, you don't feel like doing anything at all.
Yeah.
I literally dropped Parker off at school, went back to home, slept, picked him up, got him something to eat, and slept the rest of the night.
Yeah.
I was
And that sounds
constantly sleeping.
very medical and very, like that, something was way off.
We need some ketamine, honestly.
Totally off.
Let's send her into the K-hole and call it good, you know?
Yes. I'd like to get
Yes.
the K-hole.
Yeah.
Well, and at the end of the day, I mean, I think you hit the nail on the head. Awareness that it's okay to say something.
Right.
Because you're not going to fix it on your own if you've got this bias that is
Right.
never going to let you out. So you do have to feel comfortable saying, I think society's coming to that point where it's okay to say, I'm having some problems.
Right.
So if you are, say something, and then maybe it'll get fixed.
Well, good.
You know.
Is it that prevalent, or is it the same amount of people as it's always been? There just weren't resources before. We, just like a lot of other things, we're quick to, we have a obesity issue in our country. So we're really quick to come up with all these different, programs and diets and pills and all that. But have we ever looked at the root cause? Our processed foods that we eat in abundance.
And calories in, calories out.
Well,
At the end of the day, that's
shall we
the
get
problem.
back on? And should we get back on this thing? Are you eating well? Are you sleeping well? Are you, outside and being active? And then how much of our mental health problems start to disappear when people take those, healthy habits on those? They're all connected again. So it's just interesting to me that it's one more thing where we throw medication at it, but have we actually gotten to the root cause? There are those legit cases, and there are people that I think truly are afflicted with it. But the 17-year-old that's broken up with the boyfriend and then starting to make bad decisions, was medication the right choice? Or did we have to intervene with some other healthy life habits that are going to help?
Well, and I don't disagree with you at all. I mean, the body's trying to maintain homeostasis of everything in itself.
Right.
And the second you start affecting things like weight and your hypothalamus and, your thyroid, that affects everything else. And now you've got these other molecules that are going crazy. So again, at the end of the day, everything in moderation. Eat healthy, exercise.
Which is no fun.
Yeah.
It's easier
April's
to
like,
take a pill.
"Just give me the K-hole. I want the K-hole."
But again, exciting stuff in medicine, and who knows, maybe it will help a lot of people that actually need, like you said, that urgent relief, the people that are dealing with, PTSD or the death of a family member or something, to be able to get them that immediate relief is pretty impressive.
Yeah, I'm super pumped to see where it goes, that research, because, obviously it's not really, FDA is not just going to let some docs prescribe it to you right now.
Right.
But it's not too long. I think it's coming probably.
Good stuff.
Be awesome.
Okay.
Yeah.
Well, if you like what you saw or heard today, check us out on YouTube or our podcast.
Or visit our website, medicalconfessions.com.